we will be talking about could targeting brain inflammation could hold the key to slowing or reversing Alzheimer's progression. It's by me, Leslie Chetty. So let's dive into it. Could targeting brain inflammation could hold the key to solve or reversing Alzheimer's? Why this question matters. Brain inflammation is now believed to play a major role in how Alzheimer's develop and worsen. Immune cells in brain called microglia may overreact to plaques and tangles, causing more damage than protection. New research and medications are exploring how controlling this inflammation could slow or even stop the disease. Let's go deeper. What is brain inflammation, you may ask? Let's go deeper. Brain inflammation, also known as neuroinflammation, occurs within the brain or spinal cord and is the body response to an injury, infection, virus, or allergy. Inflammation processes in the brain can affect how we think, act, feel, and move, often without any apparent cause. This is the normal healthy control. Healthy control. We see the 60-year-old has a no brain inflammation and 71 no brain inflammation. Excuse me. And 79 no brain inflammation. But here we see the Alzheimer's disease, a 61-year-old, maybe none, maybe a 70, a little, but 81 is worse than, like brain, I think, is shrinked. You may ask yourself, what is Alzheimer's? Why it matters? So we will go into the definition first. A condition where memory and thoughts become dysfunctional and most common cause of dementia. Alzheimer's disease is a specific brain disorder and is the most common type of dementia. Accounts for 60 to 80% of all dementia cases. Impact affects million globally, over 6 million in the US alone. Places a huge burden on families, caregivers, and healthcare system. No cure yet, but there are treatment to improve symptoms, but no cure exists yet. Let's see the stats for the dementia, aka Alzheimer's. We see that in Finland alone, there are 54% of the people in 100k die every year, and females and males. And this looks normal, right? And these all stats like countries we see they're doing okay, I would say. And females, they're doing okay too. But there are more deaths per year compared to male. I wanna know like why. Why is it like that? So did some research on why is it like that, and found out that mainly because women tend to live longer than men. It's because age is the biggest risk factor for dementia. is living longer increases the likelihood of developing it. What? Alzheimer's disease. And I wanna know like more. Like why? Why? Let's look into it. We see the how does it start, you may ask? Abdominal protein buildup. Alzheimer's begins when two types of protein, beta amyloid and tau, starts to behave abnormally in the brain. Beta am, am, amyloid, beta amyloid clumps together to form a plaques between neurons. Tau protein twists into triangle inside the neuron. Disruption in the brain communication. These plaques and tangles blocks communications between the brain and the damaged cell. Brain cells damage and death. Over time, like humans, our brain and neurons in it begins to shrink and lose function and die, especially in the areas involved in memory, like hippocampus. Symptoms. The disease can start 10 to 20 years before the symptoms even starts are noticeable. Early signs include mild memory losses and confusion and defect, difficulty with thinking or planning. That not anything like, but it has to like repeat. I think not everything can be like like dementia or Alzheimer's. Not, but if you do it like rapidly or if you have a pattern, then yes. But if you do it like normally because you're stressed from your homework and whatever, no. But inflammation and immune response, what does it do? The immune cells, microglia, become overreact, causes chronic inflammation, which adds to the damage. And what can we do? Progressive brain shrinking. As more brain cells die, the brain shrinks and cognitive functions decline, leading to full symptoms of Alzheimer's disease. Like here, you see the knot. It takes 10 to 20 years before the symptoms even appear. Like this. Now let's go deeper. Let's see the stages of Alzheimer's today. This is the healthy brain. We got all the nerves and all the cognitive function, and we got the spinal cord. But here we see the brain is fully normal, healthy, but here is the Alzheimer's brain. Look at that. It's shrinky and probably lost everything. It's dying, basically. Dying. Let's see hippocampus. Why is it important? The hippocampus is critical for memory formation and spatial navigation. Alzheimer's disease, cause of beta amyloid plaques and tau tangles are formed in the area. Disruption of communication between neurons. Why does it matter? Because we see that it needs the special information and navigations, and how does it impact the functions in Alzheimer's disease, memory loss. It occurs early because hippocampus is where short-term memories are converted into long-term memories. Converted into long-term memories. So, if this one and if this one don't do good, then this becomes the big problem. This becomes big problem. Long-term memory. Because if your hippocampus don't do good because the memory losses because of beta amyloid and tau, that's why. And learning and navigation abilities are composed as the hippocampus shrinks and loses function. Like when you when it's the first time you learn how to ride a bike, you don't know how to ride a bike, but you do. You do now, I hope. It's like learning new things, getting short-term memories into long-term memories. Like when you started learning how to ride a bike since you're a kid, it stores in your hippocampus. It becomes short-term memory to your long-term memory. That's why whenever you ride a bike, you still remember how to ride a bike, because when you're a kid, you remember that, and it went from short-term memory to your long-term memory. And in the enteropal cortex, why is it affected? The enterophyl cortex serves as a connector between the hippocampus and other brain regions. It's like a connector where it helps with every connection in your brain. It is the first area to impact by Alzheimer's. First, it will, if your connector is affected, then your whole hippocampus and your cortexes will be affected too. That is not good. And it disrupts memory, organization, and navigation abilities, same as hippocampus, because it's the functional and connector. Since it links the hippocampus, damages here leads to difficulties in forming and recalling memories. So it's like short-term memory won't store into long-term memory, so you couldn't recall anything from your hippocampus or cerebellum. Now, cerebellum cortex, why is it affected? It is responsible for higher brain function. Alzheimer's disease spreads to the frontal and temporal lobe areas. They are involved in cognitive progressing and decision making. If these two are gone, then your brain is for nothing. It's actually nothing, because here you see this is the frontal lobe. It comes to the temporal lobe. It comes to the frontal lobe. And if this is affected, these both are affected, then you're done. You'll be in the cases of Alzheimer's, yeah. Thinking, reasoning, and language skills are impaired as disease progresses. You will forget everything. You can't judge anything. You can't make a decision for yourself. You can't speak any other language. You can't even think, or you couldn't even give a reason. Nothing. Individual may experience impaired decision making and loss of self control. Amygdala. Let's go into amygdala. What is amygdala? Is responsible for emotions, relation, regulation, and fear response. It also plays a key role in progressing emotion memories. Alzheimer's can dispute these region functions and impacting how emotions and memories are stored and recalled, like hippocampus. And this affects emotional regulation is composed, leading to mood swings and increased anxiety and irresponsibility. As the disease progresses, it may be outburst of aggression or fearful behaviors. Brainstem, brain stem and other areas is late stages. Okay, this is late. Brainstem. Why? It controls the basics functions like heart rate and breathing and swallowing. If these three things stop working, you're dead. Yeah. As Alzheimer's progresses, the damage to neurons spreads to these regions. In late stages, it can lead to difficulty swallowing. Yes, and loss of motor controls. Motor controls are important in your body. Without them, you won't be able to do anything. Inability to breathe independently, like you will forget how to breathe, and these symptoms often lead to fatal complications in advanced Alzheimer's. So you basically needs a caregiver, or you need a good healthcare provider. What are the current options for slowing Alzheimer's progression? We we have GLP-1 receptor agonists. Early studies suggest that it may reduce brain inflammation and slow disease progression. Emerging research on reversing symptoms. Synaptic paredes PHDP5. In mouse model, the predict PHDP5 restored memory and learning abilities, indicating potential for reversing cognitive decline. Healthy habits, regular exercise and balanced diet, mental stimulation, and social engagement are associated with better cognitive health and may slow disease progression for Alzheimer's. And how to prevent it? Take take care of your heart, control blood pressure, cholesterol, and blood sugar, cholesterol, and blood pressure. Exercise regularly, at least 150 minutes per week. It helps the brain. Eat healthy. Eat brain-friendly food. Try mild or Mediterranean diet. Greens, brains and fish and nuts. Keep your mind active. Read, do puzzles, learn new things, play strategies games, stay social engaged. Avoid isolation spend, by spending time with your friends and family. Aim for 7 to 9 hours of restful sleep every night. Avoid smoking. Both are linked to fast brain and aging. Manage stress and mental health. Practice relaxation techniques and treat anxiety or depression. Why are the brain cells are dying and why is the brain shrinking? Toxin proteins build up, like we did talk about, like beta amyloids outside the cell, tau inside. They build up the brain, and the proteins from tau and the beta, it blocks the communication between neurons, and we have inflammation, we have brain malfunctions, cell death, and hippocampus, cerebellum context. Yeah. Can we treat the early diagnosis for Alzheimer's to improve treatment? Yes, you can. How can we treat? You have to have a better planning, improve safety, and mental health support, and reduce fear emotions. And you can do some clinical trials too and prevent accidents and medications mistakes.